Welcome to this video on general surgical instruments. This visual guide is designed for MBBS students to help with instrument revision and identification. Surgical instruments are broadly classified based on their primary function. These main categories include cutting, grasping, hemostasis, and retraction. Surgical blades consist of a reusable handle and disposable blades. The key blades are number 11 for stab incisions, number 15 for delicate surgery, and numbers 10 or 20 for skin and muscle incisions. Bard-Parker handles hold the detachable blades. Handle number 3 fits small blades for fine work, while handle number 4 fits large blades for heavy skin incisions. For dissection, we have surgical scissors. Mayo scissors are robust, heavy, and used for cutting tough fascia, sutures, or heavy tissues. Metzenbaum scissors have long handles and fine blades with blunt tips. They are used exclusively for delicate dissection and should never be used for cutting sutures. Stitch cutting scissors have curved blades, often with a flattened or notched tip, specifically for cutting and removing postoperative sutures. They should never be used for tissue dissection. For grasping, we use tissue forceps. Toothed forceps, like Lane's, are for tough tissues such as skin. Non-toothed, or plain, forceps are used for delicate structures, like vessels or nerves, to prevent trauma. Artery forceps, such as Spencer Wells or Kelly, are used for hemostasis. They have a ratchet lock and transverse serrations. Primary uses include clamping bleeding vessels, holding fascia, and blunt dissection. Halsted mosquito forceps are smaller artery forceps. They are used for hemostasis on small vessels, delicate tissue handling in areas like plastic surgery, and occasionally for passing fine sutures. Alice tissue forceps are holding instruments identified by their multiple, sharp interlocking teeth at the tips. They are used for grasping tough structures like fascia, but are contraindicated for delicate organs. Babcock forceps are used for atraumatic holding. They have triangular fenestrated jaws with no teeth, making them ideal for grasping the appendix, bowel, ureters, and other delicate tubular structures without crushing. Sponge-holding forceps, like Rampley's, have oval, fenestrated jaws and are long. Their main use is prepping the skin with antiseptic, swabbing deep cavities, or removing laminated membranes. The Mayo Hagar needle holder is used for suturing. It has short, stout jaws with crisscross serrations and a central groove for a firm grip on curved needles, secured by a ratchet lock. In summary, instruments are categorized by function. For example, Metzenbaum is for delicate dissection, artery forceps for clamping vessels, and Babcock for grasping delicate bowel or the appendix. The Mollison mastoid retractor is a self-retaining retractor with sharp curved prongs. It is traumatic in nature and used for retracting skin and periosteum during procedures like a mastoidectomy. Cheadle forceps are long, heavy, non-ratcheted instruments. They have curved jaws and are used for maintaining a sterile chain, allowing for quick pickup and release of sterile items. The clinical application of Cheadle forceps is primarily to transfer sterile items from a drum to the sterile trolley. They are usually stored in a tall jar containing an antiseptic solution. The Langenbeck retractor is an L-shaped, manual retractor. Its key use is superficial retraction of skin edges, fat, and fascia. It is commonly used in pairs during hernia repair or appendectomy. Doyen's retractor is a large manual retractor with a broad, curved blade resembling a scoop. It is primarily used to retract the urinary bladder during pelvic surgeries, such as LSCS or hysterectomy. The Balfour self-retaining retractor is a mechanical instrument that uses a frame and a lock mechanism. It is used in major abdominal surgeries to provide wide, sustained exposure of the abdominal cavity. The C retractor is a double-ended instrument used for retracting skin and superficial fascia in smaller incisions. Its shape is beneficial because it does not obstruct the field with a heavy handle. The Morris retractor is a right-angled, L-shaped manual retractor with a broad, flat blade wider than the Langenbeck. It is used for retracting the abdominal wall during laparotomy. Deaver's retractor is a C-shaped retractor with a flat handle and a hook. It is specifically designed to hold back heavy viscera, like the liver, stomach, or duodenum, often used in open cholecystectomy. To distinguish between the two, the Morris retractor is L-shaped and focuses on the abdominal wall, while the C-shaped Deaver retractor is for deep, heavy viscera like the liver. The Backhouse towel clip is used for draping. It has sharp, curved, penetrating tips and a ratchet lock, primarily used for fixing surgical drapes to define the sterile field. Doyen's towel clip uses a cross-action spring mechanism instead of a ratchet. Pressing the handle opens the sharp, curved tips, and releasing it clips them shut, securing surgical drapes. The Humbee's knife handle is specialized for harvesting split-thickness skin grafts. It has a roller guard adjusted by a screw to ensure a uniform and exact depth of skin is removed. A proctoscope is a tubular metallic instrument with a blunt obturator. It is used to inspect the anal canal for conditions like hemorrhoids, fissures, or tumors. The fistula probe is a long, highly malleable metallic instrument. Its primary use is to explore the tract and identify the internal opening of a fistula in ano. The blunt tip makes it atraumatic. Doyen's intestinal occluding clamp is an atraumatic instrument used in bowel surgery. It has thin, flexible blades with fine longitudinal serrations to occlude the lumen gently and prevent leakage. Longitudinal serrations in Doyen's clamp are essential. They prevent the bowel from slipping without crushing the wall, minimizing trauma to delicate blood vessels, thus ensuring tissue viability. Pear's intestinal crushing clamp is a heavy, traumatic instrument with a double lever mechanism. It provides immense pressure to seal and destroy all layers of the bowel wall before division. It must only be used on the segment to be resected. The double lever action of Pear's clamp ensures a complete obliteration of the lumen. This aseptic closure creates a clean serosal ribbon, allowing the surgeon to divide the bowel without contaminating the peritoneal cavity. In a typical bowel resection, Doyen's occluding clamp is placed on the viable end, and Pear's crushing clamp is placed on the segment to be removed. Resection is performed between the two clamps. This diagram summarizes the difference between the occluding and crushing clamps and their placement during bowel resection. Here are some practical Viva questions. Longitudinal serrations prevent slippage without damaging blood supply. Pear's clamp is absolutely contraindicated on bowel intended to stay in the patient. Sterilization is typically achieved through autoclaving. For exam success, remember to demonstrate the correct grip, state immediately if the instrument is traumatic or atraumatic, know the sterilization method, and be ready to list multiple uses. Next, let's briefly review the sterilization protocols and methods for surgical instruments. Autoclave, or moist heat. Sterilization is the most reliable method. It uses steam under high pressure at 121 degrees Celsius for 15 to 20 minutes, killing all microorganisms, including bacterial spores. The hot air oven uses dry heat to destroy microbes by oxidation. Standard settings are 160 degrees Celsius for 2 hours. It is used for metallic instruments, glassware, oils, and powders. Its main limitation is pore penetration. Chemical sterilization primarily uses glutaraldehyde. This is a high-level disinfectant. Disinfection takes 20 minutes, while sterilization requires 10 hours of immersion. It is ideal for heat-sensitive items like endoscopes. Instruments must be rinsed with sterile water to remove toxic residue. Gas sterilization uses ethylene oxide, or ETO, which acts by alkylation of proteins. It is ideal for heat and moisture-sensitive items like plastic catheters. ETO is toxic and flammable, requiring a long aeration period of up to 24 hours to remove residues. Gamma radiation is known as cold sterilization. It is performed using COBALT60 and requires a standard dosage of 2.5 megarads. This method is used for the mass sterilization of pre-packed, disposable items like blades and IV sets. This final slide summarizes the main sterilization methods, comparing their mechanisms, uses, and limitations.